Hello friends, our today's topic is management of syncope. So what is syncope? Syncope is caused by decreased cerebral blood flow leading to transient loss of consciousness and postural tone associated with spontaneous recovery. It is also known as fainting, blocking out and falling out. So in syncope there is spontaneous recovery and there is loss of consciousness for a short period of time. The prevalence rate of syncope is 1 to 3.5%, which is very common in case of female. You must have seen the syncope patient during the periodic assembly in schools or during the anatomy lecture. So coming to the various causes of syncope, first is cardiovascular. In cardiovascular syncope, there is cardiac arrhythmia due to disruption in the cardiac rhythm and due to structural and obstructive disorder. If there is any obstruction in the cardiac structure, then it leads to the decrease in cerebral blood flow, decrease in BP, which leads to the syncope. Then second is cerebrovascular syncope, also known as neurogenic syncope. Then third is disorder of blood flow and vascular tone, in which there is vasovagal syncope, which is very common, and today we will discuss about vasovagal syncope. Then orthostatic hypotension, which is because of the prolonged standing. Then the situational syncope, which is due to anxiety or any situation which is fear promoting or having fear. Then next is carotid sinus syncope. The next classification is other classification, in which there is seizure, metabolic disorder and psychogenic causes. So today we will be discussing about the vasovagal syncope in detail. Vasovagal syncope is very common and it is mostly occurring in 50% of the population. Vasovagal syncope, in common term we call it fainting. Fainting is very common because of the prolonged standing, because of the decrease in hemoglobin, decrease in the blood pressure of the patient, and because of the fear and anxiety producing situation. It is also known as common fainting, and it is because of the prolonged standing, because of the hot or the extreme environment, because of severe pain, anxiety and fear, because of the fatigue and stress leads to vasodilation, and because of bradycardia. So normally the stress or these trigger point will cause the vasodilation, and this vasodilation lead to the decreased cerebral blood flow, which leads to the syncope or the common fainting. All these triggered point is preceded by prodromal symptoms, which may leads to the paleness of the patient, there is decrease in BP and there is loss of consciousness. So what are the prodromal symptoms? The prodromal symptoms are, because of the decreased cerebral blood flow, there will be blurred vision, there will be nausea, there will be dizziness, and there will be weakness, there will be diaphoresis, there will be bradycardia and decrease in BP. All this will lead to the decrease in BP, paleness, and leads to the fainting or the loss of consciousness. Now coming to the pathophysiology of syncope, as we know there are different factors which is responsible for maintaining the cerebral blood flow, like cardiac output, systemic vascular resistance, mean arterial pressure and intravascular volume. All these factors are responsible for maintaining the blood flow. Any interruption in any of this factor will leads to the decrease in cerebral blood flow, which leads to the bradycardia, and there is loss of consciousness or fainting. So all these factors are responsible for maintaining the blood flow in the cerebral, and if there is any interruption, it leads to the syncope. Now coming to the history taking of syncope, suppose if the patient is coming, or if you have a patient of syncope, then first we will rule out whether this syncope is of standing syncope because of the vasovagal effect, or it is in the supine position, in which the supine position syncope may be because of the neurocardiac causes. So first we will evaluate the blood. In case of blood, we will check the hemoglobin, we will check the glucose concentration in the blood, and if the cause is cardiovascular, we will go for ECG and EEG, and for further evaluation we will go for CT, MRI, MRA and Doppler ultrasound. All this evaluation will be done if there is repetitive syncope. If the common fainting is because of the decrease in hemoglobin and glucose, we can cure it easily. But if the cause is cardiovascular or neurogenic, we have to treat it accordingly. Now coming to the treatment part. So treatment, first we have the acute condition. If the fainting is acute and transient, we will do the tilt training. We will raise the leg from above the heart, and it will increase the blood flow to the cerebrum, and there will be regaining of consciousness. Second, we can use the salt and fluid, which may leads to the increase in BP, and there will be maintenance of cerebral blood flow. In drugs, we can give beta blocker and protamine, which is very useful in case of syncope. Then second, in case of orthostatic hypotension, because of the standing position, we will rise slowly from the supine to the sitting position. We will avoid medication that cause the hypotension, and we will use the compression stalk to improve the renal return, and we can give the IV fluid to maintain the blood flow. Then next is cardiovascular disorder. For cardiovascular disorder, we will go for EEG and ECG, and we will evaluate accordingly. Now coming to the various differential diagnosis, syncope can be confused with seizure disorder, in which there is loss of consciousness for a longer period of time. In syncope, it is transient. Then second is hypoglycemia, which is due to decreased blood glucose, and the patient can regain the consciousness after giving 10% of dextrose. Then third is panic attacks. Then coming to the various complication, the various complication is injury due to fall, because there is sudden syncope or fainting of the patient, there will be injury due to fall. Then coming to prognosis, in non-cardiac cause it is 0 to 12%, and in cardiac causes it is 18 to 33%. Now coming to the various dental implication. If you are doing the dental treatment and you experience the patient with syncope, what you will do? First, you will stop the procedure. Stopping is the procedure is the first step. Then you will remove all the sharp objects from the place, because it may leads to the injury to the patient. You will always give the LA at 30 to 45 degree in the reclined position and not in the standing position, and you will introduce the fearful object slowly, and after conditioning, less fearful things you will introduce first, and later on the more stressful or fearful object. Then you will observe the eye of the patient or pupil of the patient to know whether the patient will go in syncope or not, and then treat accordingly. Be careful and always observe the signs of the syncope.